Hi, Dr. Iyer. It's so nice of you to take time out of your busy day and be a part of this. It's so important for us to raise awareness to the different types of cancers that you treat. Can you first just introduce yourself and tell us where you're from and why you do what you do?
Thank you for having me. My name is Iyer. I'm a medical oncologist and I work on the GI team here at Roswell Park. I've been here for almost 19 years and I am originally from Mumbai, India, and did my training in oncology right here at Roswell Park.
So you also treat liver cancer. Could you describe what liver cancer is and maybe some of the side effects, or maybe some symptoms of liver cancer?
Liver cancer is a broad term and should be distinguished with primary cancers of the liver and tumors that have metastasized to the liver. And we treat both, but primary liver cancer is on the rise, and it's the one that you hear of that happens because patients had cirrhosis or hepatitis, viral hepatitis, chronic hep C possibly, and sometimes because of alcohol, or increasingly the incidence is because of something called NASH, which is a kind of a inflammatory condition of the liver. Liver cancers are often treated, if they're found early, with surgery and ablation and even a liver transplant in appropriate cases. But for patients that can't have those treatments, we now have some very exciting opportunities to make a real big difference in their survival with immunotherapies and other targeted drugs.
So immunotherapy is something that you use to treat liver cancer as well, along with chemotherapy?
Yes, traditional chemotherapy doesn't seem to have a big role in the treatment of liver cancer, but with immunotherapy and a combination with drugs that target the blood vessels and blood vessel growth, we're seeing some really exciting good findings, good results, as well as some cures, which was previously really not that often seen.
Are there any standard screening? Is screening available for liver cancer?
So with the patients with liver cancer that have a history of cirrhosis, screening is offered through various different programs throughout Western New York, through your primary care doctor's office or your gastroenterologist. And the screening is of the cirrhotic liver using ultrasound and a blood test called alpha-fetoprotein. And those are ways to screen and see if within the fibrosis or the scar of the liver has something developed that's of concern.
So, the 11-day power play supports research here. Are there, how important are the dollars raised for the work that you do?
I can't stress enough how critically important the dollars raised from the 11-day power play and all of our fundraisers are for our patients and for the work we do to find new treatments.
What are you hopeful for? As a physician treating cancer here at Roswell, what are you hopeful for?
Every day I hope that patients come here and allow us to be part of their care team and add maybe even just small tips on how they can do better with this diagnosis. For many, having a clinical trial ends up being really that big hope, that big bank that gives them a lot better time than they would have had otherwise. And I would like to have more trials available for my patients. On an everyday basis with every patient I interact with, I hope that they leave feeling we care and that we did something that made a difference.
How many patients do you see per month that are new to you?
Every week I see between 6 and 8 new patients and close to 60, 70 follow-up patients, and many have GI cancers like pancreas cancer and liver cancer.
And they come from all over the U.S. and maybe beyond?
Yes, I think this pandemic has made it possible for us to even do virtual consultations, and we're seeing a little bit more of that. Patients do travel from all over central Western New York as far as Erie, and sometimes even further out of state, and come up for some of the cool trials we have.
And Roswell Park just recently was named the number 14th cancer care hospital in the United States. How does that feel for you and your team?
It's absolutely exciting, and we know we give good care, but having that validation and ranking in the top 1.5% really makes us feel like we're doing something important and good and worthwhile.
Dr. Iyer, thank you so much for being a part of today and sharing so much information. Is there a message that you may have for the 11-Day Power Play players, the volunteers, and all of our supporters that do donate a lot of time and effort to the organization and your wonderful hospital here?
Thank you to each of you for what you are doing. You have taken it upon yourself to contribute and give back to this community, and your hard work is paying off every single day, and we are always looking for ways to thank you, and if we can ever do anything for you, please don't hesitate to ask.
Well, thank you, Dr. Iyer, for all your hard work, and we wish you well with all of your research.